very common condition that we see very often, and there are a wide variety of presentations, right, from very mild to very severe, but herniated discs, like in a spine. And, a lot of people call them slip discs. A lot of people reference, like, they're made up, they're analogous to a jelly donut. I don't love that analogy. It's not, the disc is not as delicate as a donut. It is a very dense ligament, and it's designed to connect the bones in your spine. And essentially, when it becomes herniated, all that really means is that the outer ligament has become injured or damaged over time. And as a result, the gelatinous material that sits inside is allowed to migrate. So if we look at a disc, this is kind of what it looks like top down. And essentially that outer ring or ligament is really dense. It's called the annulus. There's a gelatinous material inside. And you can see that there's kind of an indentation here because that's where the central canal is. And usually when it herniates or protrudes, and again, there are a wide variety in terms of severity, but it kind of looks like this. And this would be sort of at the mild end. We can have a disc bulge, which really is just damage to the annulus itself, which allows it to bulge circumferentially. What that means is on all sides. But a protrusion looks like this. That's an actual herniation. And in many cases, they're contained. They're not outside of this disc. So the idea that the jelly is kind of squeezed out of the donut is not always the case. And more importantly, if that does happen, that is typically an immediate trip to the ER and a surgical visit. So this does get worse over time, typically, because again, discs don't have the ability to heal. They're poorly vasculated or have a poor blood supply, and they typically don't heal on their own. What happens is when they're injured, they start to degenerate over time. And that kind of leads to some of the other things we talked about in terms of spinal stenosis and what comes along with that. In terms of like spine complaints or disc issues, there's, in my opinion, never do surgery on the spine unless it's tumor or growth, instability, or infection. And what instability means is that if the problem is bad enough that it's creating neurological deficit and weakness in our extremities, then that is an unstable segment, right? And those are typically surgical. But now we have a new procedure, it's called Discseel, and we don't necessarily have to cut the disc out, even if there is leg pain. So it's a really unique protocol or procedure that allows us now to heal or seal discs very quickly. So that outer annulus portion of the disc, what happens is we have little tears in it, and they're called annular tears. And when the inner material starts to migrate outside, it starts to seep through that annulus, and it really irritates nerves and creates sciatica, most commonly in low backs. So because of that, historically, we've only had really one solution, which was to do a discectomy, which is to cut out the disc. The problem with that is a lot of times they don't always work, so the disc herniation can recur, especially in some of the minimally invasive procedures. But more importantly, once we cut the disc out, yes, it gets rid of the leg pain, but at the end of the day, the low back pain and some of the other issues, some of the other symptoms that are coming from the spine themselves aren't really addressed because that's not the nature of that particular procedure. More importantly, we start to see accelerated degenerative change down the road. So yes, it is a short-term solution, and it's done with intention to get the pressure off the nerve, but now we have a solution in a minimally invasive environment. It's done via an injection protocol, very similar to a lot of the regenerative procedures that we use, and it's designed to seal the disc and heal it in a very short period of time. Do you know anyone who would find this information useful? Please share this video with them. We want to educate as many people as we can.